This is part 5 of the first part of the skeletal system lecture, um, which includes the axial skeletal system. And let me get my pen where it'll write. Okay, so, and we're going to talk about the bones of the face. Remember, the skull consists of the cranium that protects the brain and then the facial bones that protect the face. So the function of the facial bones is to protect and support entrances to the digestive and respiratory tracts. Of course, that means the mouth and the nose. The facial bones are also the sites for attachments of muscles for facial expression and manipulation of food, chewing food, like raising your eyebrows or smiling, any of the facial expression, the many facial expressions that we have. Um, the only movable facial bone is the mandible, which is movable at the temporomandibular joint. And that joint, of course, is where the mandible is connected to the temporal bone. I think this is temporo. I think that's an E, but anyway, the maxillary bones are the bones. I always think of it as the maxilla, as the mustache bone, because it's the bone that forms the part of your that connects to your upper teeth, and it forms the area between your nose and your lips, where a mustache goes. So I always think of the maxilla as the mustache bones, but it actually is larger than that. It connects all the way to the temporal bone, and it connects up with the nasal bones. So um, the maxilla articulates with all facial bones except for the mandible, which you would think, because it's the upper jawbone, or the upper the bone above the jawbone, I guess you could say. You would think it articulates with the mandible, but it doesn't. It only articulates with all the other facial bones except for the mandible. So that means it articulates or forms a joint with all the other facial bones except the mandible. It is the largest facial bones are the maxillary bones. Um, and let's see, we do have sinuses in the maxilla, the maxillary sinuses, and the infraorbital foramen is actually part of the maxilla. And remember, that is below the orbit or below the eye socket. And specifically, that foramen is the opening for major sensory nerves from the face. And the palatine bones form the posterior surface of the bony palate, or what we call the hard palate or roof of the mouth. That's the palatine bones. And the vomer articulates with the palatine bones, and it supports the partition that forms part of the nasal septum. You may have heard of, like, someone with a deviated septum. So the nasal septum is connected with the vomer. All right, the zygomatic bones are the cheek bones. That's good enough. The nasal bones form the bridge of the nose. The lacrimal bones are located within the eye socket or the orbit, um, and they're actually um, kind of in the corner of where the corner of your eye would be. Um, I always think about the lacrimal bones. I remember those because they're located in the place where, if you were crying, where your tears would actually come down your face. They would come down like the sides of your nose. And there is a lacrimal canal that connects your eye socket to your nasal cavity, and that's within the lacrimal bones. And it actually, if you ever notice that if you're crying really hard, if you start, if you start crying, sometimes it seems like your tears are coming out your nose. Um, that's you know that's not, it may be some mucus, but it is literally tears that are coming through your eyes, through your nose. So the lacrimal canal is found within the lacrimal bones. And again, they're in the location immediately lateral to the nasal bones. The inferior nasal concha um, actually have a different purpose than the middle and superior nasal concha. The middle and superior nasal concha, remember, circulate the air and warm the air and humidify the air. Well, the inferior nasal concha change the airflow and deflect the air toward the olfactory receptors. Deflect the air toward your smell receptors. Okay, we talked about paranasal sinuses. This is a collection of sinuses or cavities in your skull. The frontal sinus is in the frontal bone. The ethmoid, um, the sphenoidal sinuses are in the sphenoid bone, and then the maxillary sinus is in the maxilla, and all of these drain into your nasal cavity, and they help to lighten the weight of the skull. I just want to go back real quick. Um, okay, yeah. They're located, they're called ethmoidal cells, but these are the ethmoidal sinuses as well. So the bones that contain paranasal sinuses are the frontal bone, the ethmoid, the sphenoid, and the maxilla. The mandible is the lower jaw, the jawbone, um, and it articulates with the temporal bone at the mandibular fossa, which is like a little depression so that the temporal bone can fit into that depression. The hyoid bone is not attached to any other bone, doesn't have a joint with any other bone. It serves as a base for the muscles associated with the larynx or voice box, the tongue, and the throat. It's small and U-shaped, and it's located here, just above your um, larynx and your trachea. As far as infants and children, the skull bones of infants are not completely formed, so we have fontanelles, which are areas where there's cartilage still, and these areas have not been filled in with bone tissue yet. Um, So when the frontal bone comes together and meets with the two parietal bones, it will eventually form an interlocking joint called the coronal suture. And then there won't be a frontal suture, but there will be a sagittal suture that joins the two parietal bones to each other. And then there will be a lambdoid suture that separates the parietal bones from the occipital bone, and you can't see the squamous suture from this point of view, but the fontanelles or the soft spots make the head more flexible, so it allows for easier delivery of the head during labor, and allows for the bone to grow. And it takes until the child is about age 4 for that entire process to complete. The vertebral column, which is also called the spine, consists of 26 bones. 24 are actually the vertebrae, and then there's the sacrum and the coccyx. In the vertebrae, we have 7 cervical vertebrae, we have 12 thoracic, and 5 lumbar. The sacral region is 5 fused vertebrae, that's the sacrum, and then 3 to 5 fused vertebrae form the coccyx or the tailbone. So if you add these up, 7 plus 12 is 19, plus 5 is 24. So that's the 24 bones of the vertebrae. Let's see, and you can remember this by the times of day that you eat, as long as you eat an early dinner. So 7 a.m. we wake up, breakfast, and then 12 p.m. we eat lunch, 5 p.m. We have dinner. And I know everybody's schedule is different, but if you can remember that 7, 12, and 5, that might help you. So, and that's the way I was taught it. Let's see. As far as curvature of the spine, there are some primary curves that are present at birth, and that's the curve of the thoracic vertebrae and then the curve of the sacrum. Then there are some secondary curves that develop after birth that include the cervical curve and the lumbar curve. All of these are developed by age 10. Sometimes the spine curves, there's an abnormal curvature of the spine. Kyphosis is an exaggerated thoracic curvature, which maybe looks like kind of like a humpback. Lordosis is an exaggerated lumbar curvature. And scoliosis, you've probably heard of, is an abnormal lateral curvature. It's when the spine, instead of being lined up vertically, it curves, laterally. And these can be treated with braces for the most part. The vertebral body, I really just want to focus on, like, individual vertebrae um, all have a vertebral foramen, and that is for passage of the spinal cord. The spinal cord passes through the vertebral foramen of the vertebrae. All the vertebrae have a vertebral body, and then the spinous processes are the processes that cause the ridge along your backbone that you can actually see or feel through your skin, through the skin of your back. Muscles attach to the transverse processes, and they also attach, the back muscles also attach to the spinous processes. And let's see, I don't want to cover everything, just what you're going to have on your quiz and your exam. I definitely want to cover the atlas and the axis, which are C1 and C2, the first cervical vertebrae and the second cervical vertebra. The atlas articulates with the occipital condyles, which I mentioned to you earlier, of the occipital bone. And what the atlas and the occipital joint allows is for nodding yes, the nodding yes movement. And then the joint between the atlas and the axis allows for the shaking your head no movement. So that is a rotational move. And I am not going to really get into the distinctive features of the different vertebrae. I do want you to be familiar with the thoracic cage. It does protect the heart, the lungs, and some of the internal organs which are located above the diaphragm. The ribs and the sternum form the rib cage, and the sternum contains, the top part of the sternum is the manubrium, and then you have the body of the sternum here, and then there is a process called the xiphoid process um, at the end, or inferior to the manubrium. We have 7 pairs of true ribs, which are attached to the sternum directly by costal cartilages. And then we have 5 pairs, 8, 9, 10, 11, 12, 5 pairs of false ribs. and 2 of those are actually floating ribs. The false ribs are not connected directly to the sternum.